This is your Senior Moment, brought to you by Senior Guide USA, with your host, Lee St. John.
Hi and welcome. I'm Lee St. John and I have a fabulous guest with us today, Diana Pliner from the Advanced Physical Therapy and Wellness Center. Welcome, Diana.
Thank you.
So today we're going to talk about how to handle chronic pain with physical therapy. Now, I know not just in seniors, in a lot of people, chronic pain is a significant issue, but certainly as we age, a lot of people tend to really see an increase in their levels of physical pain. So first of all, can you talk with us, what do you describe chronic pain as?
Chronic pain is a non-curable issue that a lot of our elderly patients have. It may subside from time to time, but it is always there.
Can you give me for instance, so a patient would present with what sort of issues to be classified with chronic pain?
Osteoarthritis, arthritis, water retention, sciatica. There's a number of different things. It just really depends on the age bracket of the patient and their activity level.
Okay. And so you mentioned activity level as well. One thing we should point out right at the very beginning is, obviously check in with your doctor, but in general, physical activity is going to be one of the wonderful ways, even if it's just walking, even if it's just doing something very basic on a regular basis to keep the body moving. Would you agree?
Yes, very much so, yes.
Yeah. So tell us with regard to when we talk about physical therapy, when we talk about PTs, what is physical therapy?
Physical therapy is a resource that we offer to a lot of our patients post, pre-op for surgical, chronic pain, acute pain, wellness issues. It's a wide variety. We help manipulate, go to the source of where the problem and the pain is, try to relieve that with many, many different techniques. It's a wide range that we use here at the office, from laser to infrared to diathermy, to manual techniques as well as exercise to be able to help the patient relieve any type of pain that they're in.
Okay, so let's step us through a couple of those. So when you say laser, for a lot of seniors, that sounds scary. What is it? How does it work?
We have a light and laser therapy that we use, and what it is, it's a machine that we put on parts of the body depending on where the issue is. And it helps with the healing process of the muscle, tissue, and things of that nature inside the body.
And you say you put it on the body, so does it hurt? Like, what's the experience?
This is a cool laser, so there is no heat involved. It goes directly onto the patient's skin, on that part of the body that hurts. And the laser actually helps with the treatment, the healing process.
Okay. And another modality you mentioned with manipulation. Now, that sounds very medieval. Diana, talk us through. What is manipulation?
Manipulation is actually helping a lot of the older clientele who cannot maneuver their arms and their bodies the way that they need to in order to get the significant improvement. We actually manually help them do that. If they can't move their shoulder past their head, we take their arm and we start moving it for them and kind of manipulate the joints so that way they can get
the range of motion.
Yes.
Yes. All right, so we've discussed laser, we've discussed manual manipulation. What are some of the other techniques that you use?
A lot of it also is therapeutic exercise. We try to make sure that the patients are able to maneuver, lift weights, use the exercise ball, treadmills, all the equipment that we offer here in the office, dumbbells for the rehabilitation. We also offer heat and E-stim. E-stim is a technique that we use. We put pads on a patient that's hooked up to an electrical stimulation machine, and it sends impulses to the muscle to manipulate it to move back and forth and release some of the tension that's in it.
And again, that to somebody who's not experienced it, again, sounds very, very torture-like. But having experienced it myself, it can actually be very pleasant.
Yes, as long as you let the therapist know what your tolerance level is. Sometimes it can be very annoying. Sometimes it can be very soothing. Depending on the setting, you just have to make sure your therapist knows what your tolerance is for the E-stim, and you're all good to go.
Diana, give us a situation where somebody's walked in the door, they have chronic pain, and after one or several treatments, they've seen significant decrease in that level of chronic pain.
We had a patient about 6 months ago come in with sciatica on her right side of her hip.
Most people know what sciatica is, but for those who don't, can you give us an explanation of what it is, but also physically how it presents in the body?
The nerve that stems down the spine area is really inflamed and aggravated. They can have pain in the lower back. They can have it shooting up the back. Most of the times it's in the hip and the leg. It radiates down whether the right or left leg, wherever side is bothering the most. When this patient came in, she was actually sleeping in a chair. She was not able to sleep in the bed because it was too much pain. Her initial visit with us was pretty rough. She caused her significant pain, probably because we loosened up the vessels and the blood flow was a little bit more. But after her second, third visit, she was actually able to sleep in her bed, walk on her own without a cane and a walker, and was just very pleased with the end result.
Oh, that's wonderful. And that was over a series of approximately how many treatments, Diana?
She was in total for 12 visits, but by her fourth visit, she had noticed a significant decrease in the pain.
Wonderful, wonderful. All right, so what are some of the things that seniors can do themselves at home, their own version of physical therapy?
Stretch, move, get out, walk, do shopping. Instead of just sitting at home on the sofa in the chair or playing cards that, some of them go to daycare centers, get up, move around, do your exercises, swim.
What are the physical benefits of swimming?
Oh, it's a lot. It's not as impactful as walking or running or being in the mall. You're actually lifeless in the water. You're able to float, but you're actually able to strengthen your muscles in the water because you're actually having to tread water, fight with the water to maneuver back and forth, things of that nature.
Wonderful. So for patients to actually come to a centre such as yours, are they always referred by their medical practitioner?
Not always. With the insurance regulations and guidelines, usually we do like them to see their primary care doctor first to be evaluated to make sure that we are treating what needs to be treated. But some insurance companies do allow the patients to come to us without a prescription or referral, which we do have several that do come here.
Terrific. So if we're to wrap up with, let's say, the top 3 things that people could do in general to either reduce chronic pain or to minimize the risk of it becoming chronic in the first place, what would be your top 3?
Diet, making sure they watch what they eat. Depending on the patient and their health issues, doing your 2,000 to 2,500 calorie diet or making sure you exercise, eating fruits and vegetables, high protein, just the normal stuff, staying away from the junk food and the processed food as much as possible.
Great. So that's tip number 1. Tip number 2?
Be in touch with your primary care doctor. Any issues you have with your primary care doctor, he needs to be aware of. Changes of medications not agreeing with you. Some of our patients don't realize that the medications that they're on sometimes hurt them more than help them, and they're not aware that they can let their primary care doctor know this so he can tweak their medications.
That's a really good one. And I think a lot of seniors as well feel like, I don't really want to bother him with that.
Right, and there's quite a few of them that, sometimes that's all they do is see doctors every day, all day. So the last
Sure.
thing they want to do is to call him and say, hey, this isn't working for me, and want him to come back in.
Yes. And so tip number 3?
Tip number 3 is to stay motivated. As long as you are motivated to do things, it's so much easier. When you're home and you're, woe is me, and not being able to get out and enjoy life, it really takes its toll, mentally, physically, emotionally. So to be motivated, to get out, to be with your friends, to be with family, just to sit outside rather than inside, and as they say, stop and smell the flowers and the roses from time to time.
That's a wonderful tip, no matter what it is that you're doing. And especially if you're, consider your grandchildren, consider your children, consider if you don't have grandchildren, consider the grandchildren of your friends. You want to be able to live a long, healthy life. So get out, get active, get motivated. Diana, thank you so much. So where do people find you?
You are welcome. They can visit our website, which is www.advancedptmd.com. We are located at 4000 Old Court Road, Suite 100, Pikesville, Maryland, 21208.
Nice part of
all of our information and helpful tips and everything are on the website. Our phone number is 410-415-0005. We can pretty much get you in within 24 hours. I mean, we are one-on-one here at this office. We are definitely not a revolving door when it comes to PT.
Diana, thank you so much. And again, that's advancedptmd.com. Diana, thank you for your time today. It's been wonderful speaking with you.
Thank you very much.
This is Lee St. John with Your Senior Moment, brought to you by SeniorGuideUSA.com. Have a great day. Bye.